Hey there, psychology students. Professor Zeeb here, and welcome to another short lecture. This time we're going to be talking about one of those disorders that's kind of hard to sort of think about, and for people who are struggling with this to deal with this, and that is PTSD, known as post-traumatic stress disorder, but most people know it as PTSD. Okay, so obviously a stress type disorder. And this one was first named in 1980. So it does have its roots around that time in a previous edition of the DSM, where it was first named. So let's dive in deeper into PTSD, post-traumatic stress disorder, and kind of learn about it, what it entails, how common it is, etc. All right, so we're going to start off with our clinical description of PTSD. So PTSD involves feelings of fear, helplessness, or horror after a traumatic event. So, for example, this could include battle or a war type situation. It could entail, severe child abuse or experiencing a rape, for example. So, some type of very extreme traumatic event has happened, and it's often a reaction to that. Now, keep in mind to be diagnosed with PTSD, the you cannot diagnose the person until a month after the trauma. So that is written into the DSM, is that the diagnosis, you have to wait a month basically to diagnose the person with this, because it's pretty normal for people to react in a stressful way to those types of situations. So this is showing a more prolonged effect of that trauma that doesn't seem to be going away and seems to be more chronic. So in other words, we would consider it to be normal to be stressed out by experiencing battle, where you experience combat and you saw people killed in action, unfortunately. However, if it progresses after a month, then it shows that it's more of a persistent problem, more a chronic issue. All right, so what does PTSD involve? Person may have flashbacks, which are strong emotional memories of the traumatic event, almost like they're reliving the traumatic event. However, it turns out that the memory for the events are often affected by that. So the memory may not be completely clear. The person may avoid anything that reminds them of the trauma. So in other words, they may be attempting to avoid unpleasant emotion connected to that actual event. So for example, if something traumatic, happened at a concert, for example, they may completely avoid concerts in the future because, it reminds them of that traumatic event as an example. We would also expect to see emotional numbness. So the person may appear to be detached or have trouble concentrating, for example. In other words, they're showing a restriction in emotional responses, which, as you can see, would affect their social life. If you cannot express your emotions appropriately or have trouble, getting through those, you can see how it would affect your social life. Person is chronically overaroused, easily started, and quick to anger, to the point where it may cause difficulty sleeping because of recurring intrusive dreams. You may have heard of night terrors. So night terrors are often connected to this one, where they're having these really vivid and scary dreams in connection to the traumatic event. So in other words, they're being very, very stimulated to the point where it's causing problems, in this case, sleeping. So some new criteria has been added to PTSD in the DSM-5, so our current edition, our current DSM-5. So basically, they have now included reckless and self-destructive behavior as part of this disorder. In other words, this could be a sign of increased arousal, as we explained earlier. The DSM is also giving a dissociative subtype, uh, which basically uh, where they're not reenacting or showing hyperarousal like we would see in the traditional version of this. So, in other words, they're having less arousal than normal, and it's showing almost like the numbing effect. This would also be coupled along with dissociation from feelings of reality or a detachment. So that's why we give that name dissociative subtype. The reason this is done is because we think that this subpopulation of PTSD may respond differently to treatment than the full-blown PTSD or the traditional version of that. Okay, so next I want to talk about acute stress disorder because obviously there's some common denominators with this one. So the DSM-4, our previous edition of the DSM, included acute stress disorder. And basically, this is shown when the stress is shown immediately after the trauma. So in this case, within 1 month. Now remember, with PTSD, we said you would have to wait at least 1 month to get a diagnosis. So if the person is showing signs of stress immediately after the disorder where it's impairing them, then we would give them this designation of acute stress disorder. And this was often done to satisfy insurance companies so the person could get some type of label to qualify for treatment and support, for example. When we look at the research for acute stress disorder, and that's why we're kind of talking about it here, is that 50% of people who are diagnosed with acute stress disorder, in other words, they're showing immediate reaction to that event, so 50% approximately go on to develop PTSD. So about half of that population will eventually develop PTSD. However, many who eventually develop PTSD did not show the criteria for acute stress disorder. So it's a little bit controversial, but we think there may be somewhat of a connection between those two. Really, to me, the defining feature is that they're showing severe stress immediately after the event, within 1 month, basically. All right, so let's look at some statistics of PTSD. So in other words, how common is it? So the studies are basically showing that there's a 3.5% of people show PTSD during the past year, and then 6.8% will show it sometime in their lifetime. Typically, it's connected to combat, being held captive, tortured, or kidnapped, and sexual assault are the most common cases that show up in research, is what we found. So, in other words, what this sort of is, painting a picture of is that the person probably has probably has close exposure to the trauma, and that seems almost necessary to actually developing it. Because if you think about when we look at these, a lot of these would involve pretty much close contact with that traumatic event. So, in other words, this would explain why those are probably the highest uh, category or different instances of trauma that could actually lead to PTSD. So, this has been confirmed through studies of Vietnam veterans, Hurricane Katrina, 9/11, just to name some. So, we do see connections to traumatic events that seem to be like firsthand, if you would. Unfortunately, PTSD is often linked to suicide, and it often predicts suicide independently from other problems such as alcohol abuse. So, unfortunately, this one is very serious because it could lead to some serious problems such as suicide. So, we want to really get the person to get treatment and to get them help and support that they need. All right, so this will conclude our short lecture on PTSD. So make sure you read on to learn more about the disorder, including the typical causes and the different treatment of PTSD.